So I find that most Jamaicans attach their self-worth to their genitalia. For example, Jamaican men get biggest ego boost by how readily they can get an erection and how long they can maintain said erection. And then the women tend to attach, their goodness to how compressed their vagina is or how clean it is. And so because of that, we make a lot of choices here in this country about our genitalia that might not be great for health. Men, you first, come. You guys who keep drinking these things out of bottles, but name whatever roots, whatever herbs, strong back, all kind of names. Do you even know what's in them? How many of you actually read the labels if there is a label? Because someone I buy from some restaurant when I have no label on the back of them just say, this good for X. I want to take it back and drink it. I want to know what in there. The ones that do have labels, how many of you actually read the labels? Do you know what's in it? Have you read any of the properties of these herbs and roots? Also, when I have herbs and roots and I take Viagra or Viagra's cousins, Tadalafil, you should not be doing that without a doctor guiding the selection of the medication to the workup associated with taking said medication. You can't just take sildenafil not knowing if you have any heart conditions, not knowing what your blood pressure is like when you're about to take sildenafil. You don't know if you're allergic to any of the components in the medication. You just get up and just take it because what? It's gonna make sure that you get an erection easily. It's gonna make sure that you maintain it. That's gonna be all well and good until you get one, a heart attack during or after sex. Two, you suddenly lose your vision in both eyes or one eye. Three, you suddenly stop hearing. All of those things are gonna come like a ton of bricks, and then you're going to realize that maybe it wasn't worth it. If you feel like you absolutely have an issue with erectile function, it is best for you to go and see a doctor so that that doctor can write you up for the appropriate test before starting sildenafil, aka Viagra. Now on to the women. No, come here. Please, I'm begging you, stop inserting things into the vagina. A piece of garlic frightened me already in the same place. Yeah. A piece of garlic jump out and frightened me when I put that speculum in. Please stop doing that. And the other thing, I'm gonna keep washing. When in the bed, I want to push up soap in there. Why would soap be inside? The vagina cleans itself. Say it with me. The vagina cleans itself. Stop pushing soap up there. Stop pushing all kind of fluids. Stop using douche, this, that, the other. You do not need to push anything up there except an insert if you have an infection and you've been prescribed said insert. Stop pushing things up there. Alright? That's not good for your vaginal health. It's going to lead to irritation, and irritation will lead to discharge, odor, and all the other things that you're trying to avoid. Right? So this practice that we have of being and push up and in there with soap, worst idea you could have. Please stop doing that. Alright? Guys, let's make better choices about genital health. Any choice that you want to make about genitalia based on symptoms that you're having, please speak to a physician first. Explain your symptoms to them. They will examine you thoroughly. They will, where applicable, write you up for certain tests, and then you can talk about medication. But don't just stay home pushing up random things in your pads, taking random things to make it work the way you want it to work. Guys, please don't do that.